So the epidemiology studies are predominantly case control studies. These are people who have non-Hodgkin's lymphoma and people who don't, and you ask them about their past exposure histories, and then you look to see if any of those exposures are associated with having the disease or not having the disease.
Welcome back. You're watching the Dr. Nandi Show, and joining us today is Dr. Chris Poetier, who's a cancer expert who was former director of the National Center for Environmental Health at the Centers for Disease Control and Prevention. Dr. Poetier, thank you for joining us today. I appreciate it.
Thank you for inviting me.
Oh, it's our pleasure. So you served as an expert witness in all three trials and sharing your knowledge of a link between glyphosate and cancer. Dr. Poetier, why do you think there's a link? What makes you say this when there's so many other organizations that are saying that there's no link at all?
There's three types of scientific evidence you use to make that determination of whether there's a link. First is studies in human populations that have been exposed to Roundup. The second is studies in animals that have been exposed directly to the active ingredient, glyphosate. And the third is mechanistic studies where they look in cells and things to see what causes cancer. When you bring all of that information together, it's a compelling argument that this chemical can cause cancer in humans.
And many folks who are on the other side, there's many who believe what you're saying, of course, but there are people who feel that these are associations and they're not a cause and effect. You know, for many of our viewers are not scientists, so maybe you can go through at least a couple of studies and what types they are, so to make the case that it's not just an association, meaning for those you're watching, it's not like saying, I had blue jeans on and I had cancer, so then they're associated, but the blue jeans did not cause cancer. So, you know, associations are one thing, but cause and effect. If you could maybe go through a little bit of what kind of studies that you're talking about.
So the epidemiology studies are predominantly case control studies. These are people who have non-Hodgkin's lymphoma and people who don't, and you ask them about their past exposure histories, and then you look to see if any of those exposures are associated with having the disease or not having the disease. Those are associations, and that epidemiology is not strong enough by itself to say that glyphosate causes cancer. But then you go look at the animal studies. There are 13 studies in rats and mice. And of those 13 studies, there were 35 different cancer types across the 13 studies that were associated with increased risk of glyphosate. Now, in those studies, everything is controlled except the exposure to the chemical. So any increases you see in cancer are almost certainly due to the chemical. So you've got a variety of increases. The most important one is what's called malignant lymphoma in the male mouse. Malignant lymphomas look very much like non-Hodgkin lymphoma in humans. So you've got a similar disease between humans and the rodents being caused by the similar compound. And then there's the mechanisms that tell you it is possible that this is causing cancer in humans.
If you're following along, that, you know, Dr. Poetier is suggesting is that you not only have the case control studies, so the case control studies, the epidemiological studies are associations. Like we talked about, two things being found together. For example, in people with this cancer, you have this risk factor, which is, let's say, glyphosate. Now, you add on top of that the animal studies that show that when you have this substance present, that these animals have an increased chance of this lymphoma. So you have not just one, but two real sorts of evidence. The problem is that it's hard to do a randomized control study on a human population saying, give this exposure and not. The numbers that it would take to make that study powered and be sufficient. And then there's not really a huge desire for people who have the resource to do that. And listen, I don't want you to be on the spot if you feel like you can't answer that. But I don't feel like there's a big impetus for people to look at this at all, because there's lots of dollars involved and there's lots of interest involved. Do you feel that that's true in the United States? I'm
not sure I understand the question. There are 3 cohort studies, which are, you can't do a controlled clinical trial with a toxic substance.
Right.
It's unethical, it's immoral. But what you can't do is follow farm workers over a long period of time and see what they're exposed to and what diseases they get. There are 3 such studies like that, one in France, one in Norway, one in the United States. And when combined in a recent paper, they show an increased risk of non-Hodgkin's lymphoma from exposure to Roundup.
And so my question is, I'll say it very simply, I don't think people want to know these answers, and the people who have the resources are not asking those questions. Of course, you're talking about these cohort studies, but again, if you really want to disprove this, you can have confounding variables. You can use a variety of methods to try to disprove it. I'm not saying I don't believe what you're saying. I'm just saying that if people really wanted to find the answers with the resources, those great studies could exist. And he's absolutely right. You cannot tell people that take a substance, and as Dr. Poetier said, it's a toxic substance. But, you know, we're being told again and again by our own organizations that it's not a toxic substance. So this is where for folks who are listening, they're in their subdivision seeing their folks having Roundup sprayed all over. So they're saying, well, wait a minute, they're telling me it's non-toxic, but this doctor, this scientist is telling me it's toxic. Do you see the disconnect for folks who are watching?
Until the International Agency for Research on Cancer independently evaluated the literature for glyphosate and said it was probably carcinogenic, every other organization that had reviewed the literature said it was not carcinogenic. It was no hazard. So scientists investigate things that they think are hazards. If they're being told that this is not a hazard, they're not doing any studies. And so you don't have the evidence out there you want to have. Once the International Agency for Research on Cancer came out with their conclusion, there has been an explosion of research with new papers coming out every week on understanding why this could happen and what's going on, and all of it seems to be positive. So it's building a stronger and stronger case as time goes on.
I really appreciate you taking the time, you know, and talking about this and giving some clarity, Dr. Poetier. I really appreciate it.
Thank you. You're welcome.
All right. Great, fascinating stuff. Coming up, Bob Quinn, an organic farmer who's trying to change the world, grain by grain. Stay with us. Amazing stuff. Hi, everyone. I'm Dr. Partha Nandi. And if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.